Cartilage restoration is a big part of our practice at Advanced Orthopedic Specialists. We started the Cartilage Restoration Center approximately 8 years ago. In the knee, there's two types of cartilage. In this particular knee, this is the femur, this is the tibia, this is the kneecap. And what cartilage is, there's two types. There's a meniscal cartilage, which is a fibrocartilage. It's very similar to the tip of your nose. It's rubbery. It's the main cushion between the two bones. You have a medial and a lateral meniscus. Then there's the articular cartilage, which is a cap that covers the bone. It's kind of like the gristle on the end of the drumstick. And when somebody gets arthritis is when they've had damage to this cartilage cap. We see a lot of athletes that have had injuries over the years of playing sports, and they damage either the meniscus or the cartilage cap. 20, 30 years ago, we know that's a progressive process where if you lose the meniscus, you cause more pressure on the cartilage cap and you end up getting bad arthritis with bone on bone that gets replaced. Total knee replacements are one of the largest growing surgeries in North America, and we're trying to do things to reverse that for our young athletes and also our weekend warriors. We've established a protocol where if we see patients that have lost the majority or all of their meniscus, we know the natural history is to have to replace the knee, and we found that we can do a meniscal allograft or a cadaver meniscus and to replace that with good success. We do it outpatient. It takes approximately 1 hour. The patient has to be limited weight bearing for a month, and we anticipate a good return in approximately 4 to 6 months. Another type of cartilage restoration is if there's damage to the cartilage cap, which is the articular cartilage, and depending on the location and the size of the lesion, there's various options. This is an example of a lesion that actually is down to bare bone, which is very painful. If we can catch the lesion when it's small, or less than 2 square centimeters, we can do a procedure called an osteoarticular autograft, where we take 1 or 2 plugs of cartilage from part of the knee that's non-weight bearing and transfer them down there. If it is larger than 2 square centimeters, we can do a procedure called autologous chondrocyte implantation, where we take some cartilage biopsies from part of the knee that's non-weight bearing, expand them to approximately 48 million of the patient's own cartilage cells and put them into the knee. If it's a very large lesion with significant bone loss, we actually take a plug of cadaver cartilage and bone and transfer it in there. They all have the similar recovery, limited weight bearing for approximately 4 to 6 weeks, and we've experienced good results with all these procedures.